As of noon today, we now have 18,947 COVID-19 cases in Georgia with 733 deaths. The state lab has processed 5,362 tests, and commercial vendors have processed 78,966 tests. We understand that these are more than just numbers. These are Georgians that we're talking about. There are families and there are communities that are impacted, and certainly all of the victims and their loved ones continue to be in our thoughts and prayers. We lift all those up who are battling this terrible virus. We remain focused on the safety and well-being of every person who calls Georgia home. Last week, the White House issued guidelines for states to begin safely reopening our nation's economy. We appreciate the leadership and share in the President's desire to reopen the economy and get Americans back to work. And as a small business owner for over 30 years, I know the impact that this pandemic has had on hard-working Georgians in every zip code and in every community across our state. With heightened supply and limited demand, crops are rotting, and our farmers continue to struggle to keep employees on the payroll. Our small business owners are seeing sales plummet, and the company that they built with them, with the blood, sweat, and tears, is literally disappearing right in front of them. Our contract workers are struggling to put food on the table. Large businesses, leaving some with reduced hours and others with no job. These are tough moments in our state and our nation. I hear the concerns of those that I'm honored to serve. I see the terror of COVID-19 on public health as well as the pocketbook. Informed by the Coronavirus Task Force and public health officials, opening up America again includes 3 phases to safely reopen and get folks back to work. To initiate phase 1, a state must meet a series of basic criteria which can be tailored to reflect specific circumstances for a region or a statewide approach. For weeks now, our state has taken targeted action to prevent, detect, and address the spread of coronavirus by leveraging data and advice from health officials in the public and private sectors. Thanks to this methodical approach and the millions of Georgians who have literally worked diligently to slow the spread of the coronavirus, we are on track to meet the gating criteria for phase 1. According to the Department of Public Health, reports of emergency room visits for flu-like illnesses are declining. Documented cases have flattened and appear to be declining, and we have seen declining emergency room visits in general. By expanding our hospital bed capacity, including the temporary facility at the Georgia World Congress Center, we have the ability to treat patients without crisis care in hospital settings. Our proactive actions have reduced stress and strain on our area hospitals as well as the communities and the families that they serve. Now, a key component of the gating criteria is testing. For weeks, I've expressed my frustration with the status of testing and committed more resources to expansion. We have partnered with the University System of Georgia, partnered with the private sector to offer drive-through services, and recently empowered public health departments across Georgia to offer testing for all symptomatic individuals and specific asymptomatic individuals. Today, we're taking that effort to a different level by announcing an even broader partnership with the state's dedicated Health Sciences University and its health system to double down on our testing capacity and meet the requirements necessary to move forward with the President's plan. As many of you know, Augusta University Health launched a telemedicine app as part of their comprehensive plan to screen, test, and treat Georgia patients through an algorithm designed by medical experts at the Medical College of Georgia. This app has enhanced public health while reducing exposure for our doctors, nurses, and medical staff. We are encouraging symptomatic Georgians and asymptomatic individuals on the front lines or in long-term care facilities to download this app this week and begin the screening process. Georgians can access the app by visiting augustahealth.org or downloading AU Health Express Care on your smartphone. You can also call 706-721-1852. This free app is user-friendly, and through this app, physicians and advanced practice providers from Augusta University Health and the Medical College of Georgia are available to users 24 hours a day, 7 days a week. If you begin to display symptoms consistent with COVID-19, day or night, you can log into the AU Health Telemedicine app or called and get screened by a clinician. If you meet the criteria for testing, staff will contact you to schedule a test at one of the state's designated testing locations near your home. Your health care information will be securely transmitted to your designated testing site. This streamlined process reduces stress on both the patient and the testing site workers. Once you arrive for your appointment, you will provide a specimen for testing. From there, we will leverage the power of several key academic institutions in this state to process these tests. These include Augusta University, Emory University, Georgia State University, and the Georgia Public Health Lab. In roughly 72 hours, you will be able to access your test results via a secure patient portal, and a medical provider will contact you directly if you are positive. The clinician will assist you with enrolling in a self-reporting app by Google named MTX, where with patient consent, the Department of Public Health can use enhanced contact monitoring and tracing. Through this partnership, Augusta University will produce testing swabs in the Dental College of Georgia Innovation Lab. By using the same 3D printers that have produced face shields for our healthcare workers, the Innovation Lab will create thousands of swabs per day. This capacity greatly reduces our dependence on vendors and government entities as we boost testing and get Georgians back into the workplace. Under the leadership of President Brooks Keel, CEO Katrina Kiefer, Chief Medical Officer Dr. Philip Kuhl, General Carden, and Dr. Toomey, Augusta University will roll out this app statewide over the course of this week. My office will release more details and timelines very soon. In addition, the National Guard will mobilize 10 new strike teams to deploy to hotspots and long-term care facilities to administer 1,500 tests per day. Testing expansions through Augusta University and the Guard will complement existing initiatives, including the Department of Public Health's capacity, Georgia Tech's CVS testing site, and our private labs. As I've said before, testing defines the battlefield and informs our long-term strategy. These efforts significantly increase our capacity as we take measured steps forward. Throughout this entire process, from creating the coronavirus task force to today, we have relied on data, science, and the advice of healthcare professionals to guide our approach and decision-making. We have been surgical, targeted, and methodical, always putting the health and well-being of our citizens first, and doing our best to protect lives and livelihoods in every part of our state. In the same way that we carefully closed businesses and urged operations to end to mitigate the virus spread, today we are announcing plans to incrementally and safely reopen sectors of our economy. To help in this battle against COVID-19, healthcare facilities across Georgia voluntarily paused elective surgeries to reduce equipment and personnel shortages. This selfless act by healthcare leaders enhanced our ability to keep Georgians safe. However, many now find themselves in a difficult financial situation, some losing millions of dollars a day as they sacrifice for the greater good. This is not sustainable long-term for these facilities. Given the recent changes in modeling as it relates to surge capacity and national supply as the needs of other states diminished, and following weeks of discussions with hospital leaders and medical providers, I believe Georgia is positioned to secure the necessary personal protective equipment for healthcare facilities to resume elective surgeries deemed essential. Hospitals should continue discussions in their regions to ensure patient safety and the safety of their workforce, making sure that is a priority. I want to applaud all the hospitals, ambulatory surgery centers, doctor's offices, dental offices, physical therapists, and healthcare professionals that answered the call of duty and voluntarily closed their doors. It is impossible for me to adequately express my grateful appreciation to you all. And to all of the Georgians who waited on getting an important procedure to allow us to get to the other side of this curve, I also would like to thank you. Your sacrifice literally helped us save lives. Given the favorable data, enhanced testing, and approval of our healthcare professionals, we will allow gyms, fitness centers, bowling alleys, body art studios, barbers, cosmetologists, hair designers, nail care artists, estheticians, their respective schools, and massage therapists to reopen their doors this Friday, April the 24th. Unlike other businesses, these entities have been unable to manage inventory, deal with payroll, and take care of administrative items while we shelter in place. This measure allows them to undertake baseline operations that most other businesses in the state have maintained since I issued the shelter-in-place order. This measure will apply statewide and will be the operational standard in all jurisdictions. This means local action cannot be taken that is more or less restrictive. Over the next few days, we will continue to closely monitor existing and potential hotspots in our state. I stay in regular contact with local leaders across Georgia, especially those in Dougherty County and surrounding counties, to ensure that we are providing adequate support. Right now, in Albany and Dougherty County, we are seeing great improvement. I talk to Commission Chair Chris Cahias on a regular basis to ask if further action is warranted. And rest assured, if any community needs the state to intervene, we will do so with their input as well as their partnership. Now, the next point is a very important one. The entities which I am reopening are not reopening as business as usual. Each of these entities will be subject to specific restrictions, including adherence to the minimum basic operations, social distancing, and regular sanitation. Minimum basic operations includes, but is not limited to, screening workers for fever and respiratory illness, enhancing workplace sanitation, wearing gloves and masks if appropriate, separating workspaces by at least 6 feet, and teleworking where at all possible, and implementing staggered shifts. Subject to the specific social distancing and sanitation mandates, theaters, private social clubs, and restaurant dine-in services will be allowed to reopen on Monday, April the 27th. We will release more information over the next few days. Bars, nightclubs, operators of amusement park rides, and live performance venues will remain closed. In the months ahead, we will be evaluating the data and conferring with public health officials to determine the best course of action for those establishments. By taking this measured action, we will get Georgians back to work safely without undermining the progress that we all have made in this battle against COVID-19. Today's announcement is a small step forward and should be treated as such. The shelter-in-place order is still active and will expire at 11:59 p.m. on April the 30th for most Georgians. We urge everyone to continue to follow CDC and DPH guidance by sheltering in place as often as you can. Limit your travel and limit who goes with you on errands to prevent potential exposure. If possible, wear a mask or covered clothing when you're in public to slow the spread of coronavirus. For the medically fragile and elderly Georgians, make plans to shelter in place through May the 13th, the date Georgia's public health emergency expires. Given the heightened risk of adverse consequences from your exposure to coronavirus, this is recommended and the safest path forward. We will release more details as we near the end of the month so the medically fragile and elderly Georgians will have adequate time to prepare. I want to continue to call on all my fellow Georgians to protect our elderly, limit your direct contact, and help them navigate the weeks ahead. As I have been doing with my mom during this time to ensure that she doesn't have to go out, I urge Georgians, all Georgians, to do the same for your loved ones and your neighbors if you are able. Do what you can to help those in need. For places of worship, holding in-person services is allowed, but under the Phase 1 guidelines, it must be done in accordance with strict social distancing protocols. I urge faith leaders to continue to help us in this effort to keep their congregations safe by heeding the advice of public health officials. Of course, online, call-in, and drive-in services remains a good option for religious institutions. I do want to thank all of the faith leaders across this state who have stepped up and put their congregations in their state many times in front of their own institutions for the greater good. I'm so thankful for you all, and I know many of you that is a painful decision that you had to make, and I know that financially it is tough as well. I feel that pain myself, but I want to thank you and encourage you to do the right thing and to help us continue to fight the coronavirus. I also realize that there are people that want to go back to in-person services. I've spoken to many who are already implementing those policies, and we're glad to help you in that fight. While I'm encouraged by the data, proud of what we have accomplished, and confident that our plan moving forward, I know that the journey ahead is going to be a long one. We must remain laser focused on defeating this virus and keeping our citizens safe. We must find ways to revitalize communities that have literally been devastated by COVID-19. We must identify opportunities for economic growth and prosperity. We will have to have tough conversations about the budget, state spending, and our priorities and values as a state. Those conversations are underway, but here's what I know. If we remain united, just as we have in this fight against COVID-19, we can overcome the challenges and the obstacles that are ahead of us. But if we allow politics, partisanship, elections, and egos to divide us during this important inflection point, our entire state will suffer. So as we begin this process, this measured, deliberate step forward, let's reaffirm our commitment to one another, to the greater good, and to Georgia's future, because I am confident that together we will emerge victorious from this war that we have been fighting. And with your help and God's grace, we will continue to build a safer, stronger, and more prosperous state for our families and our generations to come. Thank you all. God bless you. And it's my honor to turn the podium over to Lieutenant Governor Jeff Duncan to make a few remarks, and he'll turn it over to the speaker. And I want to thank both of these gentlemen for a great partnership, for their support, and for also being with us today. Thank you.